Well, hello, Dr. Pam. Welcome back to the show. This is our second recording. We were just cracking up off air, but it's so happy, or excuse me, I'm so happy to have you back. And, as I was sharing last week with our audience, we had done a first recording and we had a few hiccups, and we just felt like it wasn't quite worth it to continue that interview. And so we decided to just press pause and come back and do a take two. And I'm so excited because I feel like this conversation is going to be even better than the first. So again, welcome. I am so happy that you're here.
I really appreciate that, and thank you so much for having me back. I'm very excited to do this show with you.
It is absolutely a pleasure. Well, like I said, we've got a lot to talk about, and I did give our audience just a few little snippets as I did this little miniature solo episode where I previewed a couple of things that you had brought up in the past. And so some people, some listeners already have a taste of what's to come today. But I think, first of all, if you want to just give maybe just a brief overview of what you do, and then we can sort of talk, I think, first about your son, because I feel like Lyme disease in your son and that experience is really such a catalyst for what you're doing today. And then what we're going to move into, which is diseases and hidden infections and misdiagnosis and so forth.
So, my name is Dr. Pamela Cipriano. I am a doctor of prepared nurse practitioner. I am the founder and president of the Practice of Health and Wellness in Thomaston, Connecticut. And I treat predominantly more chronically ill people, people who've been misdiagnosed for a number of years, have been to at least 4, 5, 6, 7, 8, 9, 10 providers. Eventually get the diagnosis if it's all in your head, and then they're not happy with that diagnosis, and so eventually they find me, and then we're able to find the root cause of the disease process and correct it.
Yeah. It's interesting because you, along with so many others now, which I love to see, have sort of I don't want to say exited, but kind of exited from the conventional paradigm because of that exact thing. You just were seeing and we'll talk about this a little bit more, but you were seeing that how patients were just not getting better despite you know, I was going to say like despite the protocols that you would see in the conventional setting. And, this particularly happened with your son, who went through the ringer, and you
Yep.
went through the ringer with him. So why don't you tell us just a little bit about that as a segue? So because I just
Sure.
it beautifully folds into what we're gonna be discussing.
Perfect. So he was 6 years old. He had a bullseye rash on his calf. He had absolutely no symptoms at all. Zero. So no fever, nothing that you would normally see with Lyme disease. A lot of people have like flu-like symptoms, or they'll call it the summer flu. He didn't have anything like that. All he had was a bullseye rash. And I brought him to his pediatrician, who put him on, if I have to guess, 10 to 14 days of antibiotics. Um, he was young, so he couldn't be put on doxycycline because it can discolor your teeth. So, and he was allergic to amoxicillin. So he was put on some type of third generation cephalosporin at that point. Um, and again, absolutely no symptoms. 13 years later, we were scuba diving, and he had a lot of pain and pressure in the lower abdomen. We were about 100 feet down. And when I brought him back to the hotel room, I did a quick physical on him, and I found the smallest, tiniest hernia I could find. And eventually, he needed surgery for this. And the surgeon actually left him on the operating room table to come out to talk to me to ask if he had a connective tissue disorder that I forgot to tell him about, because when they opened him, they found his abdominal wall to look like Swiss cheese. And what his exact words were, "It looks like something is eating your son from the inside out." And at the time, I knew as much about Lyme disease as every other provider, which is absolutely zero, and didn't know why this is happening to my son. He was 6 feet tall, maybe 150 pounds, a musician. I mean, very fit, no health issues whatsoever. And it was after the surgery that the nightmare literally started. So whenever you have a chronic form of Lyme disease, there's always going to be a trigger.
Yeah.
So back in the 90s, that trigger would cause these very um, confusing symptoms, joint pain, muscle pain, exhaustion, fatigue, and it was diagnosed as fibromyalgia. I don't disagree with the symptoms. I disagree with the diagnosis.
Yes.
Fibromyalgia is just a label to put on people that you don't know what's causing these symptoms. Well, I can tell you what
Exactly.
the diagnosis is going to be Lyme disease, because in the 90s is when fibromyalgia came out, and in the 90s is when Lyme disease really took an uptick. Now, whether it was because of warmer the
Climate.
earth warming, the climate change, whether it was because of that, whether it was because of more rain, more heat, I'm not really sure. There's so many different ways of looking at it and so many different answers, in the scientific community. But somehow more ticks were available and more people were getting infected, and nobody considered a tick bite. To this day, nobody considers a tick bite. That's the biggest problem. And so it took me 10 years of researching to finally find one research article in the Journal of Urology, because his symptoms were predominantly his bladder. He eventually had to learn how to self-catheterize himself. He was 19 when this started. He was 25 when he had to learn how to self-catheterize himself. And by 28, he was told it was all in his head. So there was nothing wrong with him. He just had this issue and it was all in his head. So I contacted the researcher from the journal article that I had read, and it was a case study with my son's exact symptoms. And he is the one who referred me to the International Lyme and Associated Disease Society, where I became a member. And I found Dr. Richard Horowitz, who's a renowned Lyme expert. And I went away for training with him. I did preceptorships with him and started treat my son on treatment. And happy to say he's 38 years old, got like knock on wood, and he's doing phenomenal.
That's awesome.
His bladder continues to be his biggest issue. It tends to become more sensitive when he has more stress in his life, which is really common, even if you don't have a bladder issue. Generally, when you have more, if you're more anxious or have more stress, you tend to urinate more frequently. And if you have this stress in your life plus Lyme disease or chronic inflammation in the bladder, that inflammation is going to get even worse. And that's what happens with anxiety or stress. So, but if he's, in a good place, he really has no issues whatsoever any longer, thank goodness.
Oh, thank God. A couple things come up for me when you're speaking, or I should say, when you were sharing that story. You said something along the lines of like, there's always a trigger, because
Hmm.
you had no, like, he really wasn't showing anything for all those years, and it's so similar with things like. For me, it's been the case with Epstein Barr. So,
Hmm.
and I had a very, very severe, very, very severe case when I was 17 years old that really left me like hanging in the balance. Like, I had no idea how to repair my body and what to do afterwards. But when all these other things started happening down the line, they were like little. But when like big stressors would occur, all of this stuff would come up and I would go, what in the heck? Like, and it was really like waking the sleeping little giant inside, right? And because Epstein
Mm.
Barr is so opportunistic, and there's so many different, theories and perspectives on how Epstein-Barr works and like there's all this information out there. But end all be all is exactly what you said. It's like something can be sort of just in you, as Epstein-Barr is, I think, in more than 90% of the population.
It's true.
Uh,
Very true.
it really depends on, I think, your, like I said, like stress, big triggers, and also, there's the epigenetic conversation, and there's just different things, lifestyle. Obviously, all these things play in a role, but you wonder, like how many people just don't even they just don't even know that, these things are sort of living inside, and some people react and have these experiences, and some people will go their whole lives and they won't even know that there's like an issue inside. It's just
Hmm.
fascinating to me. Um
So true.
yeah, it's wild. And the second thing I wanted to share is really just, it's not, we're going to be talking a lot about like hidden infections underneath things. And, one thing is Lyme. Like there's these um, big diagnoses, I should say, that are slapped on people, or labels that are slapped on people. And they sort of like have these names or these things that they're just like, oh yeah, here's my thing that I have. But there's like something underneath that's never discovered. Right.
Hmm.
And one of those is Lyme. That wasn't necessarily the case with your son, it sounds like. It was more of just an investigative process. So it wasn't like he was misdiagnosed, to my knowledge, but it was just like a really, really long time before you got there, correct? Because conventional medicine just did not know what to do.
They didn't know what to do. We went to several different specialists. The first thought was that it was possibly something with the mesh that they used.
Mm.
So the first thing we did was go back to the surgeon to make sure that there wasn't a recall on the mesh. And then we went to a different surgeon for an evaluation to make sure that the first surgeon did the correct job. Then it was seeing a urologist who um, put him through a number of tests. cystoscopies and things like that to try and figure out if this, like, what was going on. He was initially diagnosed with interstitial cystitis, so he was misdiagnosed.
He was.
Then from there, we went to a different neurologist who didn't like the term interstitial cystitis because he just felt like, again, it was a label for inflammation in the bladder, and he wanted to find the cause of this. And so it was honestly only the second urologist we saw was the only one that actually tested him for Lyme disease. But he tested him through local labs. So through local labs, it's a screening process first. You do the ELISA. The ELISA is used with, I don't know if it's used any longer with HIV, but back in the day when HIV testing first came out, they did the ELISA first. If the ELISA was positive, then they would test you for HIV. They did the same thing with Lyme disease. So they screen you first. If it's positive, then they test you for Lyme. The problem with the testing, even if you get a positive ELISA, is that the bands are completely wrong. So for the IgM, meaning you currently have this disease process, 2 out of 3 bands you need for it to be a positive Lyme disease, and those are all correct. 23, 39, and 41 are all related to Lyme disease. However, IgG, meaning that in general medicine, you've had this in the past with IgG. With Lyme disease, it could mean you've had it in the past or you currently have it right now. It's an entirely different way of looking at how the immune system works. So IgM and IgG don't work the same way like it does with every other disease process because the immune system is what drives the IgM and the IgG. In the Lyme disease, or the Borrelia, which is the name of the bacteria, actually causes changes in the immune system and is able to hide from the immune system. So it's not like you have chicken pox and you absolutely have chicken pox. Or you have strep throat, you absolutely have strep throat. Entirely different way because of the way the bacteria is shaped and how it's able to evade the immune system. So the IgM, IgG category just don't work the same way. But with the IgG, you need 5 out of 10 bands positive. Only 3 are related to Lyme disease. The other 7 bands can literally be thrown away because they have nothing to do with Lyme disease. If anything, they have things to do with other bacterias and certain viruses. So why they're actually in the test is boggles my mind. But the bigger issue is the vast majority of providers don't realize that this test was never designed to diagnose a person with Lyme disease. This test was actually designed for epidemiological purposes to follow cases of Lyme disease. So I recently had my research paper published. It was published in Curious Medical Journal on March 14th.
Yeah, congratulations, by the way. It's a big
Thank you
deal.
very much.
Yeah.
And one of the peer reviewers, just by the way, the question was asked, I knew it was from infectious disease, and it was related to how I diagnosed these patients because I didn't use local testing. I used IGeneX testing. So I had the opportunity to actually put in writing in a research paper that the tests that infectious disease are using to diagnose a patient are wrong. They were never designed to be used for diagnostic purposes, ever. On the CDC website, it tells you that this is for epidemiological purposes only, and that Lyme disease is a clinical diagnosis. So somebody like me, I live on 4 acres. I have 4 dogs. I have a cat. They all go in and out. The possibility of me, especially since we live in the middle of the woods, of me all of a sudden coming up with symptoms of the summer flu, whether I have a bullseye rash or not, your first thought should be Lyme disease. Do you know where that first thought is? Down in like number 11, 12, 13, or 14. It's never number 1. That's the big problem. Because if it's not number 1 on your diagnostic criteria, you have just done this patient a huge injustice because the symptoms will go away. The initial acute symptoms will go away. And then 10, 15 years later, they're going to end up in my office or in another doctor's office that knows how to treat Lyme disease. And it's going to be because they had some kind of a trigger, just like my son, some kind of stressful situation, whether it's surgery, a death of a loved one, a car accident, COVID, the flu, whatever it is. And all their symptoms are going to come out of nowhere. And it wasn't because they were recently bitten by a tick. It was because they were misdiagnosed 10, 15 years ago.
Wow. It is so frustrating hearing this, if I'm honest. And it's not nothing new under the sun, right? Like we understand, we know how difficult it is to get proper diagnoses. We know the lack, right, in the conventional system, like and I say this, gosh, I say this probably 3/4 of the episodes that I do, which is there's a time and a place for this paradigm, and it's usually emergency or critical med. It's not stuff like chronic conditions. It's not, they're just not trained to. But I guess my real question is, why aren't they changing the testing? Like, what do you think is the reason why they're not implementing better testing? Because you can't be the only person that has brought this up or that knows this. Like, this it has to be in some people's faces.
So the biggest problem is infectious disease wants to own Lyme disease, but they don't want to learn about Lyme disease. They feel they deal with the infections, and this is an infectious disease, and that they should own it. Who should own it really is internal medicine. The primary care provider that you see first should be the one that owns it, because they're really the first ones that should identify that you might have a tick-borne disease and start testing. The I like to call it the good old boys club, because the vast majority of medical doctors, not so much now as when I first became a nurse 30 something years ago. Back then the vast majority of physicians were men. Now there's a lot more women in the field. But unfortunately, it's still the good old boys club, because they want to keep everything status quo. Try and change anything in medicine takes decades. It's not a quick fix.
Yeah.
It is 10 years of research. And then you have people that are poo-pooing this research, so 10 more years of research. So now we're about 40 years out from when Lyme disease was first really found to have expanded in the early 90s. Nothing's changed. There's absolutely nothing has changed. If anything, things might be getting actually worse. So you have people, physicians on the medical staff in a hospital, they don't want to be the only one in their tight knit group who believes in Lyme disease and nobody else does. Because they're going to be the kid on the block that doesn't fit in. And to be honest with you, I never cared about how popular I was all through high school or college. Like, I was never that person. So I really cared less about what my colleagues think of me. I care more about what my patients think of me. If I can fix my patients, that is the most important thing to me. And if my colleagues disagree with me, that's on them. They're the ones that didn't do the research, and they're the ones that don't want to really be educated.
Amen. Amen. Beautifully said. And I'm with you. I mean, at the end of the day, you have to live with the way that you're practicing. And that's not to
Mhm.
say that, it's not to say that everything that these doctors are doing is intentional, like they're intentionally trying to hurt people. But it's like,
No,
it's
they're
it's
not.
like just complacency and laziness and
Mhm.
apathy. And I just don't want to, it's like, I think I might have mentioned this on the first recording that we did, but it's like, well, I just have to pay the bills and I gotta like turn the lights on for my family and I gotta, put food on the table. And it's just better to walk this mediocre line than it is to do something different. And even though in their gut, in their like their intuitive soul, like they know that there's more. They know that there's a different conversation out there. They know that if they just start to dig, even if it's like 2 feet, like just a small hole,
Mhm.
they're going to start to uncover and discover. But there's a choice. And oftentimes they're not making the choice to do that because it's not the easier road. And that's so unfortunate.
It's not easier, and it can be overwhelming. Once you start scratching the surface and you find how much effort it's going to take to actually try and figure out what's wrong with your patient. It wasn't until I went back to school for functional medicine that I really understood how the body works. When you go to school to be a nurse, a registered nurse, and I can't speak of nursing schools now because, like I said, I graduated over 30 years ago. Everything was more functional medicine. It was all about how the body works, how everything is connected, how to practice preventative medicine, how to prevent the disease process from beginning anyway. And then your next couple of years is all about how to correct it, how to diagnose it, how to treat it. But nurses are the first ones that went out into the public health nursing to try and figure out, why are these people continuously getting reinfected with whatever disease process they were getting infected with. A lot of it is because of sleeping quarters. It's because they didn't have good drinking water. It's some of the basic things that nurses are the ones that found this, and nurses were the ones that were managing this. So for me to take a jump from nursing to nurse practitioner to functional medicine, it was such an easy jump because I was already doing this.
Yeah.
You know, I as a nurse, I was a critical care nurse. So yes, I used medication because the medication was life-saving medication. But once you got out of the ICU or while I was discharging you, it was all about educating you so you never ended up back here again, especially if it was from something like a heart attack or a stroke. Those are things that can be prevented for future, you're in your future. Certain things, you know, there's anomalies you're born with, things that you just have no control over. But for the things you can control, you can really have a very healthy lifestyle. If you think about Hippocrates, who was the father of medicine, in his statement, if a physician prescribed a medication, he failed his patient. Medical schools are no longer medical schools. Medical schools are run by pharmaceutical companies. And these doctors and physicians, they're trained that this is the diagnosis and this is the medication you prescribe. That's it. It doesn't get much more difficult than that, which is so sad. You're talking very smart people. They're physicians. They wanted to get into medicine. They wanted to help people. And then they realize they're not doing their patients any good. And then they go back to school for functional medicine and realize, wow, I was completely lied to. I have so many friends who are physicians. And so many friends of these physicians of mine that are friends are so discouraged with the education that they actually got because they weren't trained to be physicians. They were trained to prescribe medication.
Yeah. Wow. So good. I love that you just said all of that. And I know I've mentioned this on previous episodes over the last couple of years, but there's a real, like, I have a real heart for a lot of these practitioners, you included. I mean, even though you really did have sort of the right mindset from the get-go, but there's a lot of grief that comes along with putting your heart and soul into practicing medicine, or, just you have the right intentions. You're looking to help people. I mean, of course, you're looking to make money too, but you're looking to help people. And then to just like, to kind of have like for lack of a better like example, like the 2020 experience where so many people woke up and they're like, oh my gosh, just normal people walking through life. I mean, some of us have known a lot of things for a long time, but not the vast majority. And then when like 2020 hit and a lot of the COVID stuff started to surface, it's like people were having so much cognitive dissonance because they're like, how in the world could this be happening? And then the
Mhm.
more lies, more things, more stuff was coming out. Then the vax, then this, then people started dying. But it's like over and over, you're just like, this can't be real. This can't be real. This can't be real, but it's real. And so I
Mhm.
think there's just my heart goes out to a lot of these medical professionals who go through years and years of training, not knowing the real backstory. Uh,
Mhm.
and not even really having a clue about Rockefeller medicine or anything, right?
Mhm.
And then
There.
one day just being like, "Oh my gosh,
Mhm.
what? What am I doing? And what kind of system am I operating under? Because I just want to do a good job, but the system that's over me, right, is not necessarily here for patient care. They're here for profit and control, and that's really the end all be all."
And what you said is absolutely so, so true. And now think of the physician who works in a teaching hospital and has spent his entire career educating and working his way up this ladder. And now he's going to start thinking outside the box. He's going to be ostracized
Yes.
from all of his colleagues because he's going to be thinking of things that they've been taught do not exist, literally do not exist. So just think about that person and how they have to try and figure out, do I want to lose my entire career so I can save this one patient, or like what do I do here? I had I had a patient, the funniest story ever. I had a patient come to me. She had so many health problems. She was going to a local teaching hospital to get weekly IV fluid because she was told she was not able to hydrate herself by drinking fluid. And she had such severe constipation. This is after a terrible accident she had. She had such severe constipation that they were doing surgery. They were doing partial colon resections on her to try and get rid of the stool that was literally like cement. Okay. The ER director, who I'm not going to name, wrote my name and my address and my phone number on a sticky pad and gave it to her and said, "You have to see this person. She is going to help you." He didn't refer to me. He didn't send me a formal referral. He didn't call me and say, "Hey, I'm going to send you this patient over." He wanted to stay anonymous because he didn't want to get kicked out of the good old boys club. He didn't want his whole career to go down the wayside because he's trying to help this one patient. You know what? She came here. What I'm going to tell you is going to make you absolutely die. She had mold toxicity. We got her moved out of her apartment. We treated her for the mold. I got her magnesium oxide for the constipation and started her on IV fluid with vitamins, and she got better. She got better.
Oh,
No more surgeries. She had a teleconference with her GI group, and she said to all of them, "You all failed me. Every one of you failed me. I needed a vitamin in my system to be able to help me, and you all failed me." I mean, something as simple as that.
it's heartbreaking. And you know what's so sad about it is that it's not rare.
It's
That's
not.
part. It's probably, I don't even know if I want to say this out loud, but I'm going to. They say like, medical error or just the system. I'm just going to say the system is like the third leading cause of death in our country, like medical error, right?
For sure.
If we were to actually take that word error and like think about that in a different way, I don't think it's third. I think it's first.
Oh, I agree with you.
I I
I
don't
completely
think,
agree with you.
yeah, because there's so many different facets of error, right? It's not just like error, like, oh, this person made a mistake in a critical care condition in a hospital. It's also like, what kind of meds did this or did this practitioner prescribe to this person who's like on all these unnecessary meds? Or what about misdiagnosis? What about this? What about that? What about not looking under the hood? Which this story that you just shared is actually an amazing segue because, and I think again, I shared this in our first recording, a lot of these people are diagnosed with the, like I always like to say, like the Merck manual label or whatever. And labels can be helpful. I think we talked about that on the last recording. Labels can be helpful and they can often lead to some insight. Totally get it. And it's been helpful for me too. But that's often, in most people's cases, that's often where the research stops, when in fact it should be where the research starts.
You're
And
completely right.
yeah. And so, I think that with these diagnoses, whether it's autoimmune or neurological or something like, dementia or ALS, like, anything, let's talk or let's start to unpack like how on what you feel and think and what your assessment is about how many people have these diagnoses, have these labels, yet there is something that's never tapped in, aka Lyme, mold, heavy metal toxicity, glyphosate. What do you think about this? And I'm just going to allow you to sort of start this conversation. And I don't really have a huge plan here, other to just let it unfold naturally, because I think that this is happening kind of with everyone that has a label.
Yeah, I agree with you. And the label usually starts with the diet, unfortunately.
Yeah.
The label will usually start with the diet because people don't feel well. And when you don't feel well, your cortisol levels will start to climb. And when your cortisol levels climb, you start craving sugar. So now your diet, if it's already not healthy, is going to be even more not healthy. You're not thinking about the amount of water that you should be drinking, the type of flour you should be using to bake. You're eating anything and everything, and that is just fueling the fire. So now you have this chronic inflammation, you have mold and other funguses in your body that is getting fed from this junk food. You have everything is what supersized with these sodas and things like that. High fructose corn syrup is in everything. I mean, I remember one year I wasn't supposed to have Thanksgiving at my house, and whoever was supposed to have it couldn't have it at the last minute. So I'm trying to take the easy way out, making the stuffing for the turkey. I could not get a prepared stuffing that didn't have high fructose corn syrup in it, so I had to go back to just getting plain old breadcrumbs and starting from scratch. And I work, I have 2 companies that I'm running, and I do house calls, and I have really sick patients, and it's just like I was just
Yeah.
trying to make my life a little easier. I spent more time in the grocery store trying to find something without high fructose corn syrup I just couldn't find anything. I ended up having to just get plain old breadcrumbs and start making the stuffing from scratch. So our diet in this country is god awful. And if you want to eat healthy in this country, you really have to read every single label. But you also have to make sure that anything that you eat that comes from a box is not from this country. So, like any pasta we eat is going to be from Italy. Any bread that I make, the flour comes from Italy. Nothing comes from this United States because the food in this country is horrible. We have dyes that have been causing cancer in children for as long as I can remember. And it took RFK, finally, a politician, love him or hate him, he is the only one who's actually done anything to try and change the food in this country. So it's, yeah, it's chronic inflammation because that's where the food is. It is going to be tick-borne diseases because we're infiltrated with ticks, especially where I live in the Northeast, I'm in Connecticut. We have more people in Pennsylvania right now with Lyme disease than anywhere else in the United States. So it's just, yeah, we have tick-borne diseases, chronic inflammation, mold toxicity, heavy metal poisoning, chronic inflammation. It goes on and on and on. Then you run through all the tests that the hospital is going to give you, and now you have heavy metals from the MRIs that now are causing more issues. And now you have this radiculopathy from your eyebrows down to your tippy toes. So now we have to do chelation therapy to try and get all these heavy metals out of you. It is, and it never ends. But if you don't go to a doctor who actually knows how to do this stuff, you're going to be on gabapentin for the rest of your life to try and decrease the effects of the heavy metals on your nervous system, causing the burning sensation that can actually be reversed.
Yep. Yep.
I feel like I
Hey,
just blurted out a ton of
you
information
did,
for
but
everybody to hear.
you did, but it's okay. We're gonna take a step back. Let's that was incredible, and I'm gonna recalibrate us so we could because it's true. And I think that maybe I'm just, my audience, to be honest with you, my audience is pretty they're pretty in tune. Like from what I gauge, right? Like from the feedback I get, they're pretty in tune. This is not their first rodeo, but then you never know. Like there could be people that are listening for the first time and being like, "Wow." And I'm so happy about that, right? Like no judgment no matter what. Like everybody's got to start somewhere. But, I think that it can sometimes be overwhelming because when you hear this, you're just like, "Oh my goodness, where do I even start? Like, how do I even what's the first chapter? Like, and what's the first word of the first chapter? Like, how do I even start?" And
Hmm.
so, and that can be super overwhelming. And I think, for a lot of times for practitioners, that's really overwhelming too, especially when they don't have experience. But, um, I think that you're right in the fact that diet is a major player. There was a few things I wanted to say here. Diet's definitely a major player. You mentioned in the last or recording, and I think it's worth mentioning again. You were chatting about glyphosate, and I want you to
Hmm.
I would love for you to reshare the story for people who didn't hear my little miniature episode because I thought this was so fascinating about the men that you were seeing and how they had such low testosterone levels. I feel like this is a really important example. And again, it's not a fear-based little thing that I am not trying to create fear. It's really good to be aware of this stuff.
Oh, education is,
Yeah,
I mean, that's what creates knowledge.
absolutely.
If
And
you're not
action.
educated, yeah, if you're not educated, you have absolutely no knowledge and you have to rely on everybody else for your health.
Yeah.
But if you're educated and you're the one that's out there reading and researching, mm, if you go to a doctor who is upset that you are trying to figure out what's wrong with you, change doctors because I love patients like that. When a patient comes to me and says, I know most doctors don't like Google or Dr. Google, but this is what I found after I put in all my symptoms. I appreciate that because that's letting me know like you are really trying to get better. It's the person who just gives up and is just like, I don't want to change my diet. I don't want to change the way I do anything because these are the foods I like to eat when you're going to stay sick for the rest of your life. So the people who are really trying to create change in their life are I appreciate them and I respect them more than you can possibly imagine. What happened to me was I was getting these young men in their 30s, and I had so many in a row, complaining of weight gain and fatigue and erectile dysfunction, and they're losing their hair, and they just felt so old for their age. And I started doing I always test for everything, but I was also doing hormone testing on them. And their testosterone levels were below normal for somebody who's so young, and a lot of them haven't had children yet.
Mm.
So you start testosterone on somebody who is childbearing age, you're going to end up decreasing their sperm count, and there's a good possibility they could never have children. So you don't want to start somebody on testosterone. You want to find out why their testosterone levels are low. So what's happening to me was my 30-year-olds were their testosterone was in the toilet, but my 80-year-olds had testosterone like the 30-year-olds should have because they didn't eat glyphosate their entire life. So what happened was I was trying to figure out what is the difference between this two group of men, and it was the diet. And then when I dug even deeper into the diet, it was the active ingredient in Roundup. So we are the only first world country that continues to use Roundup as an insecticide, even though there is so much research about how it causes cancer, hormonal imbalances, drops the testosterone level, causes autoimmune issues, chronic inflammation. I mean, I can go on and on and on, but it's cheap and our government has not banned it yet. I don't know what it's going to take, but something catastrophic is going to happen where they're going to finally ban it, but I don't know what that means. I don't know what it's going to take for that to happen.
I mean, I feel like the catastrophic has already happened, right? Like
Oh,
how much sicker can this country be, you know? The
it's
most
terrible.
yeah, the most
Yeah,
advanced country in the world medically, right.
yeah, it's
The
awful. I mean, you're right. Other people come to this country to get help because they didn't get it in their own country. But then what does that say about their country? Because let's face it, we're not doing such a great job here with our own population,
right.
you know.
But
But
and you and I both know, I mean, there's a huge agenda behind that. You know,
I agree.
it's not that they can't. It's just that they've prioritized things over that and
Exactly.
over us, you know. And you mentioned something too that I wanted to restate or have you restate was that, and I don't think that this is thought about very often when it comes to glyphosate, because some people are like, oh yeah, you know, there's glyphosate in like the bread, or I eat gluten free because I don't want to be, you know, or I eat organic gluten free, or I buy like you, like I buy my flour from Italy. But you mentioned the beer and the wine, which I thought was
Mhm.
really interesting. So if people are, you know, if they are drinkers or occasional drinkers, like this might be something to, again, just think about when they are indulging in a glass of wine or beer.
So what they found was in the United States, there is an abundance of glyphosate or the active ingredient in Roundup in the American beer and in American wines. Because even if you're buying your wine from an organic farm, that farm is getting infiltrated with the glyphosate from the farm next door that's not organic. And it's unfortunate because they're trying to do everything the right way. You cannot prevent your own farm from getting infected with these things because of the rain, the water, the air, the wind. Everything is going to push everything to the next farm over. So what they're finding is you have to buy wine and you have to buy beer from other countries that don't use glyphosate as an insecticide order to stay healthy. And think about beer. Oh my gosh.
Yeah.
I mean, what young man doesn't drink beer? You know what I'm saying? I mean, what young woman doesn't drink beer? I had a hormonal imbalance that I didn't even know I had. If you checked my hormones on paper, they looked fine. It was after I got thermography that, I had a patient who did thermography. I had never heard of it before, and I had the company come out and do a speaker presentation for my patients, and I figured, let me get thermography done for myself so I could tell them what the procedure is like, which is nothing. There's no machine there squishing your breast to the point where you feel like it's gonna rupture. There's no radiation. It's an infrared camera that just takes pictures of your entire body or your body parts for men or women. And so I had my breasts done. Now, this is after having, I don't even know how many probably 8 years or 9 years of annual mammograms and ultrasounds. And I never had to go back for a second view because they were always normal. To finding out with thermography that they actually found greater blood supply, greater heat, and greater lymphatic congestion in one breast over the other, putting me at risk for breast cancer in 10 years. This was about 8 years ago. So when I hear an advertisement saying that mammograms prevent breast cancer? They don't prevent breast cancer. They find breast cancer. You really want to prevent breast cancer, get a thermography done because it's going to show you the precursors to breast cancer. And you're going to have an opportunity to change your diet because everything starts in the gut. So you change your diet and then everything reverses itself. If we do that, there's going to be a lot of oncologists out of business, out of practice, a lot of hospitals with chemotherapy, radiation, targeted immune therapy that are going to be out of business because our cancer rates are going to drop significantly if we are able to reverse a disease process before it turns into a disease process.
Mhm.
That's the problem in this country. So,
Yes. Yes.
yeah.
Yes. Yes.
So, and it is all your diet. It's all diet. You know, for me, it was my well water. It was my older son that found that it was my well water. You know, I drink a lot of water. It's well water. We have a filter on the entire house. It filters out everything. He said, you can't filter out heavy metals. He was right. he and my younger son and the girlfriends bought me a distiller to sit on top of the countertop, and it distills 1 gallon at a time. I was drinking that water for 3 months before my next thermography, because at this time I'm getting them every 6 months because they're concerned. I'm concerned. You know what happened? My breast tissue went back to normal in three
Wow.
months from
Just from
drinking,
changing the water.
just changing my water. Because
Wow.
distilled water will pull out any impurities. Whenever you put distilled water into a container, it will pull into that container anything that is sitting in there. So if you put this into a regular glass jar, let's say, that's made with lead, you're going to get lead in that water. When you buy distilled water from a supermarket, it's sitting in plastic, you're pulling all those chemicals into that water. So distilled water has to be stored in borosilicate glass. It's the only glass that does not contain lead. So we make it runs twice a day in our house. We drink a ton of water and it's stored in the refrigerator in borosilicate glass. And all our glass was switched over from regular glass that all contains lead to borosilicate glass that doesn't contain any lead. And the first 2 weeks I drank this water, I detoxed. I detoxed to the point where I was actually flu-like,
Yeah.
exhausted. Everything kind of ached, headachy, all that stuff. And I honestly thought I was getting sick. And then 2 weeks later, I had more energy than I knew what to do with. It was like, wow, that was all from the water. That was from just changing my water.
Wow. I'm not surprised, actually.
Hmm.
I'm not surprised. It's just sometimes it really is the basics. I mean, of course, there are other things to take into consideration, right? Like besides water and food. I mean, there's other things, and I hate to even bring them up because I don't like to overwhelm people. But there's like the EMF discussion, and there's different pollution type there's lots of other things that we can talk about here. But bottom line is like there's so much that just sits right in the food and water basket, right? Like
Hmm.
and how one thing can I'm really shocked that, like, just in 3 months, that changed for you. Also,
It was shocking.
I love how you brought up thermography because, this is a very I could tell by your face when you first started talking about it, you know how touchy of a subject this is. I did a show on, sonography and uh, like some realities about mammography and all of that. And let me tell you, like people get very defensive about their experiences and about so and so going through cancer and this person, was saved by a mammogram it's like you don't wanna discount all of that, but there is this whole other reality, not to get too off track here, but there's this whole other reality about mammography that people don't wanna hear, and also, like you said, it's a billion-dollar business, at least I think you said it's a billion-dollar business, cancer, and, I don't know, we've had the discussion here on the show before, so and while this is not an episode about cancer, it's not like they're helping us at the end of the day.
No, not at all. And they're not, I mean, the providers are not doing this on purpose. There is
No.
somebody much higher than them
Yes.
that is running
Yes.
the show.
Of course.
You know what I'm saying? But the research shows that the vast majority of lumps in the breast is found by the individual and not found by the mammogram.
Yeah.
So in our country, we encourage annual mammograms. There was a research study that came out, gosh, probably around 2016, 2017, from the College of Surgeons in this country, and explained that we are the only country that for an average risk woman still has mammograms every single year, and that the amount of radiation given is too high and the amount of pressure placed on the breast can actually rupture a neoplasm if there is one there, and that other countries are every 3 years for an average risk woman. So in other words, the BRCA genes are negative, no family history of breast cancer. Why are you going to get a mammogram every single year? That's a lot of radiation.
Yeah. Yeah.
That's a lot of radiation.
But to the
You know,
average individual, they don't think that. They don't see it as that. We see it as that, or you see it as that. You have the knowledge, and I've been in the industry for a couple decades now, so I've done the research and I've talked with experts, and I see it. But if you're just talking to an average, say, 55-year-old woman, they're like, "Oh, well, it's just once a year,"
mm-hmm.
but
Yep.
it adds up.
Would you get a chest x-ray once a year? Every year?
Definitely.
Every year. From the age of 40 until 80, would you get a chest x-ray every single year? That has less radiation than a mammogram does.
Yeah.
You see what I'm saying? And that's what people don't understand. Another thing is insurance companies, the vast majority of insurance companies will not pay for just an ultrasound. So if I have a 30-something-year-old patient that I find a lump on their breast, their tissue is so dense that that mammogram will never pick up that lump. An ultrasound might, a thermography will. But that insurance company will still mandate that they won't pay for the ultrasound unless that same patient gets a mammogram too. So you're going to give this patient radiation that they're not going to be able to use anyway, instead of just doing the ultrasound that actually can see. They have to do the ultrasound because the mammogram can't see anything through this dense breast.
Yeah.
Dense breast means that there's still so much breast tissue that you can't see past that breast tissue to see if there are any lumps. So as you get older, you're postmenopausal, that density decreases because your breast turns from breast tissue to fatty tissue. And mammograms can see through fat. It just can't see through breast tissue. So that's why anybody who is young and is concerned about it, I send them for thermography. Anybody who finds a lump, I send them for thermography. I haven't had one patient yet. If the thermography said it was suspicious, it was cancerous. If the thermography said it was not suspicious looking, it wasn't cancerous. And I never tell the person go by only thermography and don't have the biopsy. That I would never say that to anybody. But I always say to them, get the thermography first. If that is going to be negative, I can almost guarantee you the biopsy will be negative. You know what it does? It decreases their anxiety if it does nothing more. So at least this way, when they're going in for that biopsy, they have a pretty good idea that this is most likely going to be negative. And so far, I'm 100% with this. Now, I don't have that many patients getting thermographies and getting biopsies, so it's a very small cluster of patients. But from in my practice, that's what I'm saying.
Yeah. Yeah. I can't remember the statistic that my guest shared about dense breasts, but it was an alarming statistic. I think I interviewed her back in 2024, but it was alarming about how many lumps and bumps that were in fact cancerous were missed among women with dense breasts. It was
Mhm.
insanely high. Like I couldn't even believe it. Actually, I knew that that was the case, but when she actually stated it, I almost fell over. I was like, there's no way that that is true, but it was true.
Yeah.
It was true. Yeah.
A lot of times, the insurance company, if your density isn't at least 50 to 90%, they won't pay for the ultrasound. How much an ultrasound costs if you pay for it out of pocket? It's less than
I
$100.
know.
You know what I'm saying? So it's like, but people in this country, well, I have health insurance. I want the health insurance to pay for it. So if the health insurance isn't going to pay for it, I'm not going to have it done.
Yep.
That's on you.
That's right. No,
I
it's
don't know
so
what else to
true.
say about that.
I think that we were chit-chatting in all our discussions we've had over the last couple of months. We were chit-chatting about this, like just in, off air about just insurance. And I was telling you about how again, we're totally on a tangent right now, but it's fine. How I cut out health insurance. I went into crowdfunding and I should have done it years ago. I was so excited about it. I had to interview the CEO of the company because I just like I couldn't wrap my head around how I had not made the move. But it makes no sense to me because it's the scammiest thing ever, and yet the things that you really need, they a lot of times they don't even cover anyway.
They
So
won't. Yeah, they won't cover.
yeah, it's just like the things that you actually really need, right? Like
Mhm.
not what the practitioner is telling you you need, but that you actually really need.
Mhm.
So yeah, all right. Let me bring us back. Let me bring us back here. But I love it. I love it because this is this is what it's about. It's like we can go in a million different directions with this because at the end all be all is we're talking about things that are missed among the system in varying degrees, and it's important that we touch on whatever comes up because there's someone out there listening that this is going to get their wheels to turn. And so I
Mhm.
appreciate it. I appreciate all the
I
time.
agree with you.
Let's go back to or I should say, let's just keep on going. There's a couple questions that I have for you that I want to ask. In your experience and with the patients that you're seeing, have you seen people who come in with labels or diagnoses such as diabetes or such as like big name things, right? Even like I
Mhm.
said, things like neurological or ALS and stuff, where you started to look underneath the hood and you were able to say, actually, oh my goodness, you have this infection. And that could easily bend like the catalyst for the place that you're in now and then
Yeah.
rework things out.
Yeah. So diabetes, a lot of times, is from your diet. And so you change your diet, you reverse the diabetes. And that's long before Ozempic came out.
Yeah.
I did my doctoral degree in 2016, and my research was on preventing the progression from prediabetes to diabetes. Outside the research study, though, I put everybody in my practice on the exact same protocol. And people who had an A1C over 15. So diabetes starts at 6.5. So 15 is a very, very high number, very, very brittle diabetic. You give them the right foods, you give them the right information, and he lost 100 pounds in no, 75 pounds in 6 months, and he brought his A1C from 15 down to 5.4. You know how he did it? All he did was follow the diet I gave him, which is foods low in glycemic index and foods that decrease inflammation, and that's all it took. That's all it took. And this was long before the pharmaceutical industry was getting a ton of money on Ozempic. So diabetes can be reversed with diet. And I've been saying this since I was 15 years old. And every doctor I ever talked to told me, once you have diabetes, you always have diabetes. Until a drug came out that reverses diabetes and has no insulin properties whatsoever. All it does is help you to change your diet. Now they say it could be reversed.
Yeah, of course. Of course. Well, I mean,
However,
it's
I have 2 patients right now that were misdiagnosed with ALS. Now, ALS is a diagnosis of exclusion. So in other words, you're tested for everything, and if everything is negative, then it's ALS. Except when they're getting tested for Lyme disease, they're using the test I was talking about earlier that is not used for diagnostic purposes. It's used for epidemiological purposes. If you want a diagnostic test, you have to go through IGeneX for Lyme disease and Galaxy Labs for Bartonella. So both of them had Lyme and both of them had Bartonella, but by the time they came to me, it was too late. They were already paralyzed.
oh,
Once that paralysis sets in, I can't reverse it. That's the whole problem. And so the one person who came to me, my first ALS patient, she was already in a wheelchair, completely paralyzed from the neck down. And in 2 weeks, she was getting a trach placed. And so all I was able to do for her, she was referred to me from a naturopath who had tested her and had the positive Lyme and Bartonella tests there. I was able to get a PICC line placed on her, started her on ceftriaxone, which is Rocephin, 2 grams daily. And she started getting feeling into her limbs, but she never got the movement back. So there is a window of opportunity. If you miss that window of opportunity, whether it's ALS or it's a compilation of symptoms like ALS,
yes, yes.
the end game is the same. You still are going to become completely paralyzed. So finding out the reason for your foot drop quickly is the most important thing. She had her first sign was foot drop. They tested her for ALS. It was negative, but she still progressed very rapidly. So what will happen is if you have a disease process in your family, whether it's ALS, Parkinson's, MS, whatever it is, you will show those symptoms even if you don't have the disease process when you have a tick-borne disease. Her 2 uncles had ALS. She tested negative for the gene and she tested negative for ALS. So in other words, she still had the symptoms of it because it runs in the family. My cousin, her mother had Parkinson's disease. Our grandfather had Parkinson's disease. All her symptoms were coming out like Parkinson's disease. She actually had Bartonella. She had Bartonella most likely from a spider bite because she gardened all the time in her yard. So do you see what I'm saying?
Wow.
You can have these underlying bacterial infections that will come out like a neurological disorder because it happens to be in your family.
Yeah.
So she has Parkinsonian-like symptoms, but she doesn't actually have Parkinson's disease.
That is fascinating.
Mm-hmm.
That is so. And when you say in the family, like, is there an actual genetic? I feel almost silly asking this question, but I don't know. I'm not the expert. Like, is there actually like a genetic component to it, or do you think a lot of it is like lifestyle because everyone's living in the same like household, or people are growing up together and they're exposed to environmental exposures and so forth? Like, what part of that is actually like in the genes?
So according to epigenetics, our genes do not dictate our future.
Correct.
According to epigenetics, our genes are about 10% of our entire health. So you can have a family history of breast cancer. It doesn't mean you're going to get it,
Right.
but it may increase your risk of it because of your family history. But something like Parkinson's disease, MS, ALS, it can have a familial component, even if you don't have a genetic predisposition to it. So, in other words, even if you don't have Parkinson's disease and you don't have ALS, if you have chronic inflammation in your body, it can come out with those symptoms, even though it's not the actual disease process. And you'll be misdiagnosed
Yeah. Yeah.
because they're not finding the underlying cause of the chronic inflammation in your body. And
It
they're not
is
looking for it.
it grieves me to think of how many people are walking around with these diagnoses and suffering with
Mhm.
this diagnosis, not having this information, and just because they don't know, they're the doctors don't know. I mean, they don't know, and
That
so
like I said, it's not taught in medical
yeah.
school. You know,
Mhm.
these things are not taught in a general medical school. If you want to get this kind of education, you have to go back to functional medicine. You have to really get back down to the basics of how the body works, how everything starts in the gut, how our water and our food is the most important thing that we can do for our health. I mean, it's so basic.
Yeah.
It's so basic.
Yeah. How I was gonna ask you about MS, and well, there's a couple that I wanted to ask in particular, but you had mentioned it earlier, and I was suspiciously, like inquisitive about like how many patients you see with with something like MS, because that's another one I think that has a history of like hidden infection, particularly Epstein Barr, to my
Epstein-Barr,
knowledge.
yep, and Lyme disease, those 2 things. And again, it's the inflammation.
Yeah.
And it's the symptoms that they're starting with.
Yeah.
But Lyme disease and MS, they almost look identical in the very beginning stages. Only about 10% of people will actually get a positive Lyme titer on cerebral spinal fluid. Only 10% of people who have Lyme disease in their spinal column will actually get a positive Lyme titer in that cerebral spinal fluid. So you can have neuroborreliosis, meaning you have Lyme disease in your nervous system, and you will get a negative Lyme titer.
Wow.
Neurologists will say if they do the spinal tap and you have oligoclonal bands, will you have MS? Well, you can have that same test done and have oligoclonal bands and have Lyme disease. Oligoclonal bands are not only specific to MS. They're also specific to Lyme disease and a number of other disease processes, but you only hear about it with MS. So there are so many people who are misdiagnosed with MS when it was actually another disease process causing the symptoms. I have a patient right now, she's in Illinois, and she was misdiagnosed with MS. She got bit by a tick in 2012. She went to her primary care doctor who did not put her on antibiotics because she didn't have a bullseye rash. So one tick can carry up to 14 different diseases, and Lyme is the only one that will give you that bullseye rash in 30% of the population. So it's not even like you get a bullseye rash and you 100%, like if this tick bites you, you have a 100% possibility of getting this bullseye rash. You have a 30% possibility of getting this bullseye rash. So in other words, 70% of people get bit by the same infected tick. They have no sign that they have Lyme disease. So because she did not have a bullseye rash, they would not give her antibiotics. This was in 2012. In 2016, she was diagnosed with MS. That's not a coincidence.
No,
There's no
definitely.
coincidence there. So now
Wow.
she finds me last year, I believe. So she came here. She has to come to Connecticut once a year for me to be able to prescribe medications for her. We did IGeneX testing. She came back positive for Lyme disease. She went back to her neurologist and she said, I told you I was bit in 2012. You never tested me for Lyme disease in 2016 when I came here. And they had it in her chart that she said she got bit by a tick and nobody tested her.
Well, that doesn't even make sense, especially if it
Nope.
was charted.
Documented that she got bit by a tick, but nobody tested her for Lyme disease.
Oh, that's a travesty. That
Yep.
is very upsetting.
So now she's close to 40. She's doing IVF, trying to get pregnant, and she's on all these antibiotics now because she does have Lyme disease. And now she's pretty symptom free. She stopped going to the MS clinic, stopped getting the IV infusions, and she's getting her life back. And she'll get pregnant now. But she since 2016, this poor thing has been told she had MS. Well, she never had MS.
Wow. Wow. What do you have to say about those who question the antibiotic protocol in terms of like immune function and gut function and so forth when you are treating something like Lyme? Could you give me a brief overview on your thoughts about that? Because there's some concern about the long term, I should say, like fallout from antibiotic use.
So as long as your diet is very clean and you're taking a very potent probiotic twice a day while on antibiotics, at least 3 hours apart from the antibiotic, you're protecting your gut and you're protecting the microbiome. Um, I would prefer not to have to use antibiotics. There are times when somebody isn't severe, so I will start them on a protocol with just supplements, herbs and supplements. But the vast majority of people I get are so severe that, especially Bartonella, Bartonella is the game changer. That's the one that's going to end you up in a wheelchair, and that's the one that's going to kill you. That is a very fatal diagnosis with Bartonella. If you don't go on antibiotics or something like that, and you're very symptomatic, I would really encourage you to reconsider,
Yeah.
because you're not going to be on the antibiotics forever. And by the time you're off the antibiotics, we're giving you everything you need to be able to rebuild your microbiome. Especially if you've been on the probiotics the entire time, it's not that long of a journey for something like that. What the newest research is showing is that when you do come off the antibiotics, to go on the same supplements you would take to kill the bacteria, even though we're using the supplements as antimicrobials, people take them on a daily basis just for overall health. And so it's not we're doing anything worse for your microbiome, but we're continuing to kill off the bacteria, because Bartonella is a bacteria that acts like a parasite. So it will affect the nervous system. And once it seeds itself into the nervous system, there is no reversing it. I can give you all the IV antibiotics I want, and I will not be able to get that disease process under control. So again, you have a small window of opportunity to be able to kill this bacteria off. Go on the antibiotics. Seriously. We can always deal with the uh the fallout afterwards,
It's like the
and
lesser
there's
of two evils.
it really is. I mean, I remember the day that I got a death certificate on my desk, and it's only recently I can actually talk about this patient, because literally killed me. I couldn't even talk about her without crying. I was doing a presentation for the Connecticut APRN Society, and when I started talking about her, I got so emotional, I had to stop talking for a while to compose myself, because she didn't deserve this. She was seeing a different Lyme doctor who the office just forgot to order the PIC line and the ceftriaxone. And that happens sometimes. And the doctor was exceptionally busy. People who were answering the phone were responding to her. So she changed doctors. Now she comes to me. We request all the records. We get everything she had done there. We get the PIC line placed. We start the ceftriaxone. That small amount of time, I think it was like 6 or 7 weeks that went by without treatment, that Bartonella seeded herself into her nervous system. She's in a wheelchair by the time she comes to see me. I have her going to physical therapy constantly. Her husband's taking her neurology at Yale, and they're thinking she might have ALS. That's fine. Tell me what to do, because this woman is going to die. So she comes to see me on a Friday for a follow-up, and she told me that she went to see the neurologist at Yale, who were magnificent. I have to tell you, Yale is not the hospital you want to go to for a tick-borne disease, but these neurologists were absolutely fantastic. They were really trying everything to save this woman's life. She came to me. By the time she left, it was 6:30. I called the clinic. They had already closed for the weekend. So I wrote myself a note on my desk for Monday morning to give them a call and let them know she's not going to survive another 6 weeks. Like, if you think this is what might be going on, tell me what to do for her before it progresses even worse. And Monday morning, I walked in, and my whole staff was outside my own office, my own personal office, with her death certificate, because you know how emotional I get with my patients. And so now I have to fill out her death certificate. I'm calling her husband. I think I'm crying more than he was, because I couldn't even compose myself. I was so upset that over the weekend she died. And he said she just she didn't have the energy to breathe, is what happened. And that's ALS.
Oh,
And so now on the death certificate, the cause of death, I wrote Bartonella, or Bartonellosis. And I got a call from the government
I
to
bet.
find out if this was accurate or if this was a mistake. Now, I don't know if your listeners know this, but any provider who treats tick-borne diseases are literally targeted by the government.
Yep.
So I go home, and I had to talk with my husband, like, do I change the death certificate? Like, what do I do? And I've already had my issues with the government over treating tick-borne diseases. And he said, you stick to your guns. You know what you're doing. We'll deal with the fallout. And I said, this was not a mistake. She died from Bartonellosis, a rare disease process. There is nothing rare about getting bitten by a spider, or scratched by a cat, or getting attacked by fleas, or sand fleas, or body lice, or anything else that carries Bartonella, that it will not kill you. If your immune system is not as strong as it should be, and your diet isn't as healthy as it could be, there's a good possibility that this is going to take control of your life. So that's why I say go on the antibiotics. Just get rid of this, and then change your entire life. Change everything you put into your mouth, because that is what's really going to save you.
I'm so sorry. Thank you for sharing that story. I'm so sorry about your patient. I can see it in your face. You know,
Oh, that was
just buffer. That is so rough. That's absolutely heartbreaking. And I like though that you mentioned that like it really is about the state of your system because I mean, how many people get bit by a spider or get bit by a cat or like or excuse me, scratched by a cat or whatever, and like they're fine.
they're fine.
That's a very normal thing.
Mhm.
But, that's not necessarily the case with everyone because there are some people, right, that are compromised in some way.
Mhm. And they don't even realize it.
Yeah.
They go on their merry way, they're smoking cigarettes, they're drinking alcohol, they're not eating healthy, they're not exercising, so the inflammation in their body is already so great.
Yeah.
And now you add on some kind of a tick-borne or spider-borne or, vector-borne disease process, and the immune system just can't control it. It just doesn't have the ability to fight it off.
Yeah.
The patients that I get, personally get, it's like one of my husband's friends, he said, "Well, I've gotten bitten by hundreds of ticks. I've gotten the bullseye rash. I've never had symptoms." And I said, "Yeah, because your immune system is very strong right now.
Yeah.
But give it another few years and something happens where, God forbid something happens to one of your kids, or you have to have surgery, or you end up with this horrible illness and your immune system drops for that small period of time. And this opportunistic infection takes over your entire body and you'll be at my office getting treatment.
Oh,
Just get tested now so we can get you on the right treatment now rather than waiting until it
be
turns into a
prepared.
catastrophe."
Yeah.
Exactly.
Just be prepared.
Prevention is the number one way of staying healthy.
Yeah.
Just prevent the disease process from even occurring. If you know you got bit by a tick, get tested. Get on the treatment now. Don't wait until you become disabled.
Exactly. Exactly. Well said.
But
Gosh.
out of sight, out of mind. You don't want to think about
Of
about it
course.
because you don't have any symptoms right now.
Yeah. Yeah, absolutely. And it's not about being like hyper vigilant and crazy and paranoid and hypochondriac. Like that's not what you're saying.
No.
It's being smart, having awareness and knowledge because you would rather like it's kind of like don't let the car run out of gas and try to drive it, right? Like be sure that there's always like a little bit of gas in there, or at least half a tank, right? Like let's just keep up, you know? I mean, I don't even know, that's probably the silliest example ever, but
The best example though, because I remember my mother-in-law had passed and she left us her, I think it was a Cadillac or something like that. This thing was the size of a boat. And I
I
was in
know.
between cars, and so I'm driving this 1970 Cadillac, and it wasn't on E yet. Like it was literally a quarter of a tank and I ran out of gas. And I posted it on Facebook because I'm laughing at myself for being so silly. And one of my high school friends says E does not mean enough when it comes to the gas tank.
That's funny. That is so funny. I love
You're
that.
right.
I love it's
Sure
it's
that you're
true.
diligent with your car, just you are.
Exactly. Like, come on, you guys, everybody, get it together. No, as we sort of, we taper down a little bit and land this plane. There's one other like common diagnosis today that I would like to ask you about, and I'm curious as to see your thoughts and if you've seen this in your practice. And I've mentioned it a couple times already, just in a brief conversation here, but I can't help but think about all of the lead ups, I should say, the things that are brewing underneath the surface when it comes to the Alzheimer's and dementia conversation. And I actually want to do a whole episode on this. I haven't yet. I can't believe that it's been like almost 100 shows and I haven't. I'm sort of like, keeping my eye on a few people, but what is your experience with dealing with cognitive dysfunction and people and chronic or hidden infections underneath that?
So I have the perfect example for you right now. I have a patient who had breast implants placed 50 years ago. And about 3 years after the breast implants were placed, she started having memory issues. That's not, again, I don't believe in coincidences anyway. That's not a coincidence. And so 50 years later, now she's in my office. And she came here. She went to the medical, we have a medical spa here as well as a medical practice. She went to the medical spa side and she started getting IV vitamins. And we have a number of ones that are listed that you can choose from, or we can just, you come in here, you tell us what your symptoms are, we'll make something for you. And so she was doing something more for her brain function. And she felt some improvement, but not as great as she expected. So her memory was so severe that she didn't go on a cruise with her family because her biggest concern was she didn't want them to have to babysit her. And she knew she would not be able to get to her room without somebody walking her there because and this woman, I mean, she's in her early 80s now. I met her when she was in her late 70s. I mean, completely with it.
Yeah.
It's just her memory issues. So I gave her the Alzheimer's test, was completely negative. I've talked to her husband about most likely she has a ton of mold in her body from these silicone breast implants that were placed 50 years ago. So I don't know if you're aware of this, but they're supposed to be changed every 10 years.
Yeah.
3 years into having them placed, she started with memory issues. You would think they would have, the doctor would have removed them right then and there, but I'm not sure that they were connecting the dots at that point. I
Probably not.
can't find a doctor now to remove them because they've been in her body for 50 years. And
Yeah.
heaven knows what you're going to open up, So I put her on binders to try and bind any mold that might be in her system to pull it out. But the problem is this: when you're exposed to mold and you're on binders and you're still living in a mold environment, you actually get worse instead of better. So it has been a fine line trying to get her better without removing these implants
Wow.
because she literally is living in her body are mold spores. I mean, you can go on the internet and look up any research you want on silicone implants that have been in the body for 50 years, and they're filled with mold, just filled with mold. I sent her to a surgeon that I had such respect for, and I never referred anybody to him again. When he told me that without even any imaging, she didn't have a mold issue. Really? So, with your incredible eyesight, you can tell going through her clothing and her bras and her skin and everything, going right to the silicone implants, that you don't see any mold there. I want your eyes. I never referred to anybody to him again. I have my favorites that are always like they're like the ones that I only refer to because they always do a good job. The day you show me you no longer care, I no longer refer to you.
You're out.
And that was the day he showed me he no longer cared. Now you don't get any more of my patients.
Good for you. You're my type of person. You really are my type of girl.
I'm just trying to save people's lives. That's all I'm trying to do. And if
I
you
love
can't help
it.
me do that, then I don't want you on my team.
I absolutely love it. Well, and that's why I wanted you to come on the show. So that's why we've worked so hard to produce a show where people could actually listen because we've talked for hours and hours and hours here.
You're right. We
Yeah,
did.
we
We did the meet
have.
and greet first. Then we did
We
the
have.
show and it didn't come out right because the Zoom kept shutting off.
We have been through a lot. It's so funny because it's been two shows. Like it happened with two shows. I mean, now everything is fixed, but it took 98 or 97 or 98 episodes before like I really had like that kind of situation happen with two guests. So I mean, but that's okay because
Hmm.
it's just par for the course. And when you're doing something, I always say, like I said in my episode 98, I think with my friend Matt Blackburn, it's like you must be doing something right when you have that many things going wrong, right? So
That's
we
right.
just keep going. We just keep going. Before we close, I want to give you an opportunity to touch on anything that we haven't that you really wanted to mention, or just give advice to anyone that might be listening to this episode and thinking like, oh my gosh, I have a friend or it's me or I have, a sibling who's in this position or my parents, or my parents are I'm seeing memory issues with them a little bit and like I don't know where to start. Like what would your thoughts and advice be? And just anything else that you would like to share. I really want to give you the floor here before we close.
So what I would recommend is finding, and again, I would be more than happy to take on a patient because this is what I do.
Yeah.
But if you don't want to come to Connecticut once a year, depending on where you live, if you wanted to find somebody local, I would try and find a functional medicine provider who also knows how to treat tick-borne diseases. Because what you want is somebody who knows what tests to order. So you want to make sure that they're testing for the heavy metals, the chronic inflammation, the inflammatory markers, any autoimmune diseases, any tick-borne diseases, and then trying in mold toxicity and making sure that they're putting a comprehensive plan together so that they can get you better. So any of the things that I just mentioned can cause cognitive decline. It can cause joint pain. It can mimic so many neurological disorders when a lot of the times it's an easier fix if it's caught early, but it's still an easy fix thing compared to having to live with a chronic illness that you don't really have.
Yeah.
In other words, you have a symptom of a problem. You don't have that disease. You have something else that can be fixed. Can Parkinson's be fixed? No. Can ALS be fixed? No. Can MS be fixed? No. But those things that can be mimicking those disease processes like Lyme, Bartonella, mold toxicity, heavy metal poisoning, chronic inflammation, That's all fixable. That's all fixable.
Yeah.
You reverse that, you don't know if if that's the issue, and now you get your loved one back. And that's a great story. That's a great ending.
I would venture to say that in so many ways, that is what's happening with them with patients. I mean,
Yes.
I how am I I don't know the percentage, but like there has to be something that's underneath the
Yes.
diagnosis. Bottom line, that's what this whole entire episode is about. So it's like, why not? Like I said earlier, your research should start, not stop, once you get a quote unquote label, because there is something else going on, and you
Completely
very,
agree with.
very, very well. It could be so possible for you to lead a normal life moving forward, despite what people are telling you, despite what practitioners are sharing with you.
Mhm. One more thing I wanna just add too, just so people really can digest this when I keep saying it's all about the gut, it's all about what you put in your mouth. Before hemp was demonized as, a terrible plant and all, farmers were using hemp to keep their livestock healthy.
Mm.
When the government took hemp out of their ability to be used, antibiotics were increased exponentially. And it was antibiotics, steroid use, all these things were being put into the animal's body, and then we're eating that meat. So we're eating all those antibiotics, we're eating all those steroids, we're eating everything that the animal is being fed, all the garbage these poor animals are being fed. When that happened, that's when Parkinson's and Alzheimer's disease increased, oh my god,
Exponentially.
like tenfold.
Wow.
And it was because hemp decreased inflammation in the animals, where the antibiotics increase inflammation in the animals. My grandfather was from Italy. I can't tell you how many times he said, "You are what you eat." If you eat a sickly animal, you are getting a sickly body for yourself.
Yeah.
If you eat an organic animal who's treated with respect and given all the uh
Like humane treatment.
possible, yeah, that for them to be healthy, you're gonna be healthy. So if you have an animal who's been treated terribly and they're eating a terrible diet and their inflammatory markers are off the charts and their stress levels are crazy, that's exactly what's happening to your body when you eat that meat. So always remember, make sure you're eating, if you're going to eat fish, make sure it's wild caught. Make sure it's coming from an ocean that isn't polluted. Make sure that you're eating an animal that's organic, who's been treated with respect, who isn't taunted and terrorized before it's slaughtered.
Yeah.
All those things are going to or all those things, if you choose the right animal to eat, are going to decrease your risk of inflammation and the disease process.
I absolutely love that you went there, and we ended here because I have had this conversation with family members alone. And it's kind of like the whole back and forth. Well, does it really matter? Like, does the organic really matter? Does the pasture raised really matter? And blah 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 blah. And it's like, actually, yeah, it really does. And look, I
It
get
really
it. Like
matters.
I've said this countless times. Like I understand people are on budgets and their strict incomes, and life is hard right now. People are just scraping by. Many people are just scraping by, and we've all got like we all do. We just all have whatever we have, right? The means that we have, like we got to work with that. And I understand, but it might be worth, and I feel like a broken record, but it might be worth reprioritizing other things in your life, right? Just kind of like looking at, okay, where do I spend? What can I, to kind of put that on on the top of the list a
Mhm.
bit, because these things do
Mhm.
matter. And I had a friend once that told me, like, in terms of the way that the animals are treated, like it really is this like energy exchange. And
Oh, yes.
and so when animals are treated, and I mean, people think it's woo woo. I'm sorry, it's not. It is so not. It is very scientific, actually. When
Mhm.
animals are treated really inhumanely and tortured, and not to paint like any kind of fearful picture for people, but that is actually like transferred somewhat into you
You're
when you
absolutely
eat
right.
it. Yeah, and
You're
that's
absolutely
not
right.
it. That's not a pretty thing to think about. So it's not just
Mm-mm.
like what are they eating, but it's also like how are they being raised. I feel very fortunate. We get beef and chicken from a regenerative farm and feel really good about that. But and I know that's not everybody's uh circumstance. Like I realize that. But I think that there could be something. I always just say allow for them to be or excuse me, allow for there to be some thought about your priorities, because it does matter. And if you have a health condition or concern, or you just feel like, hey, I just really want to prevent disease, and you're doing all these other things, but that might be a place to look. And again, I say that with all humility and grace, because I know that people are in different financial circumstances. And, like I said, people are dealing with a lot. Um,
Mhm.
but, and yeah, whole foods are better than packaged foods and processed foods, right? Like,
Without a doubt.
well, you're doing what you can do, bottom line, but it is something to think about. So I'm really glad that you brought that up because I think it's important.
It's so important. If you have a very high priced car, you're not going to use the cheapest gas. It's just
Yeah.
not going to run properly.
Yeah.
And people care more about their cars than they care about their own bodies. And then, but that
Very true.
always blows my mind. It really, you can replace that car tomorrow. You
Yeah.
can't replace your body. All you can do, we're stuck with this, If you're guaranteed to live to, I say this to worked in a practice before I started my own practice, and a lot of them were older people, and some of these older people were exceptionally healthy, and my younger population were exceptionally overweight and sickly, just sickly because of the diet. And so I used to say to my younger population, if you were guaranteed to live to 100 years old, guaranteed, how would you live your life? Would
Mm.
you want to live your life in a way that you're guaranteed to be able to travel when you're older? Or do you want to be the person who's stuck in a wheelchair and living in a nursing home until you're 100? Because no matter what you do, you're going to live to 100.
Yeah. Yeah.
That sometimes will turn people's lives around to think like, wow, what am I doing to my body? Because if I really have to live in this body till 100, I want to make sure I'm doing everything possible to keep it as healthy as possible.
Yeah. No, you're so right. And you said it earlier, like people care more about their car or more about
Mhm.
the clothes that they're wearing or the handbags that they're buying,
Yes.
and that's
Yeah.
it's I get it. Like people have their thing, and I respect that. But goodness, for people like me, and again, you with your son and all of the things that you've experienced, both as a practitioner and a mom, and I could say this just from absolute personal experience, and I'm still walking through a very tough journey myself. Um, you don't care about any of that when your health is compromised. You don't
Oh.
care. You don't care. Your car collection, your this, your
Mm-mm.
all the furnishings in your house, whatever it is, the jewelry, the handbags, the this, the that, the trips. Forget trips because you're not even gonna be able to travel. But that stuff doesn't matter anymore. It
It
doesn't
doesn't
matter
at all.
anymore. No, and it becomes very vivid very quickly. And I learned that at a young age, when I was sick with mono and Epstein-Barr and hepatitis all at one time, like obviously all that was happening at one time, and it really changed the trajectory of my life. I remember standing outside on my porch after 5 or 6 weeks of not being able to walk well, and just 17 years old going, I will never regret standing here on my front porch, taking in fresh air, being able to say, wow, like I'm so grateful for this life. And
Mhm.
despite what has happened since then and the challenges that I've had, and again, still walking through, I still have gratitude for those moments, but it is,
Mhm.
your life changes when your health is compromised. And so it's
Oh, so true.
yeah, it's worth a thought, you know? It's worth a thought.
So true.
Where can people find you, learn more about you? What are any kind of offering that you want to suggest? Let us know, and I will make sure to put it in the show notes for our listeners.
Eat that. So I am the founder and president of the Practice of Health and Wellness. You can find us on the website, thepracticeofhealthandwellness.com. We're on Facebook and Instagram as well. We're located in Thomaston, Connecticut. I see people worldwide. If you're in the United States, I need to see you once a year to be able to prescribe medications. If you're listening from a different country and you don't have the funds to come here frequently, I can work with your personal provider and we can make this happen.
Wow, that's a nice
Hmm.
option. Very
Yeah.
cool. Yeah, because I have quite a few Canadian listeners, so
Yes. Yep.
that's a great option.
Yeah.
Okay, awesome.
Yep. Yep.
My friend,
And
it
if
is
you mention this podcast, we can give you 10% off too.
oh, okay, great.
Yeah.
I'll make sure I'll put that in the show notes. Yeah.
Perfect.
Just mention intentionally well. Okay.
Yep. Yep.
Awesome. That's
Okay.
wonderful. You guys, like I always say, make sure you check out the show notes. I'll have all this information in there for you. And if you can't find anything, or if you have any issues, make sure to reach out because I will help you and be hopefully able to point you in the right direction. Dr. Pam, it has been such a pleasure. I have thoroughly enjoyed talking with you, getting to know you, sharing stories. I love all of the examples that you've brought to the table, and you're just a gem of a human being. I really have enjoyed just this journey with
Oh,
you. Thank
I
you
really
so
appreciate that.
much.
I feel the same way about you. I feel like we really got to know each other over these 3 different conversations. So I really appreciate everything that you're doing to get all of this information out to so many different people, really. You're doing a great job. Thank
Oh,
you.
I
Thank you for
appreciate
having me.
Absolutely. It's really, really been a pleasure. Thank you. Thank you.
Thank
That's
you.
very sweet. Okay, my friends, again, I appreciate you guys so much for listening. Make sure that you reach out if you need anything from me regarding this episode or any others. And until the next time, I hope that you have a very blessed day. See you next time.